Welcome to the MAT chat. My name is Jennifer Garcia. I'm currently a graduate student at North Central College pursuing my master's in athletic training. The purpose of today's event is to provide an insight of cultural competence within the athletic training culture and other allied health professionals. To discuss the topic of communication barriers between patients and healthcare providers, for today's speaker, we have Riley Chambers, who is currently the head athletic trainer at Indiana School for the Deaf. So thank you so much for joining me today and taking your time to do this. So introducing her, she did her undergrad, her Bachelor's of Arts in athletic training at North Central College. So I'm going to leave this a little bit to you. If you want to tell your experience with any jobs that you've done right now, and then your overall experience with North Central.
Yeah, absolutely. I'm so happy to be here. I loved doing my undergrad at North Central. We had a great time. It was 4 years of a lot of hard work.
I bet.
It was a lot, but it was awesome. And it was a very full schedule with being a full-time athlete as well and having my part-time jobs to get me through college, but it was worth it. I loved it. I'm also a CPR instructor for the YMCA. I actually am teaching a BLS class tomorrow.
Are you? That's awesome.
Yeah. So that'll be fun. I'm excited. It's actually the first one of the new year that I'm doing. So I'm teaching a BLS class for 3 or 4 other Y employees and then 1 or 2 EMTs.
That's awesome.
They're getting recertified. So yeah.
Does it work as a group, or is it different classes they have to do, or how does that work?
So at most we can do 6 people at a time. That's what the YMCA allows, is that we can have a classroom of 6 for a BLS class and a classroom of 5 or 6 for the Heart Saver classes. So Heart Saver for the American Heart Association is CPR and first aid. BLS is just CPR. And that's the basic life support. That's what you have to have as a certification for athletic training.
Yeah. That makes sense.
And so I have that tomorrow, and we'll see how it goes. I'm excited.
That's awesome.
Yeah. So my experience at North Central was pretty awesome. So being a part of the women's track and field program, I had a lot of camaraderie. And teammates. My teammates were awesome too. They really helped get everything, helped keep me focused. That was awesome. And then with being in a bachelor's of athletic training, there was never a dull moment. Always very busy, which you definitely understand as being an MAT student now. And so it's something that I'm grateful for because it also taught me phenomenal time management skills. If I didn't know my time management, I would have been drowning.
Yes, I totally agree. It's such a huge part of graduate programs and even just undergrad, where you're just thinking of, okay, I have to do this, and then I have this little amount of time. How am I going to do it? So it's such a huge part of who we are as a profession too, as an athletic trainer.
Yeah, and part of that was always taking my lunch and snacks with me everywhere.
That's what I still have not learned. I feel like I still need to be okay, I need to make sure I'm eating. Making sure that you have time.
I'm horrible. I forget to eat all the time. I'm like, God, I really can't do that.
But how was your experience with track and field then? Overall, as being in the bachelor's program of athletic training and also being a student athlete?
So I got very lucky. My coaches were phenomenal in allowing me to have different practice schedules than the rest of my teammates. Luckily with track and field too, it's more of an individualized sport, not as much of the team. So you don't have to be there for the team part if you don't need to be. Ideally, I tried my best to make it to all the team practices of when we were all together, because that also helped. But a lot of the times I had a lot of schedule interferences to get my clinical hours done. So my coaches were amazing in helping me do early morning practices where we would get up and do 6 a.m. practices, and I'd get my lifting and everything done in the mornings. and then I'd be able to go to all of my clinical rotations in the afternoon, evenings. So that was super awesome that they helped me with that balance.
That's awesome. And where did you do your clinical experiences at?
So I did my clinical experiences mostly all on campus. During my tenure at NCC, we had COVID, the majority of it. So we got sent home, and then we had to battle and deal with the remote learning and learning how to be around each other while still having distance and the masks. But after that, so my offsite clinical rotation before COVID hit actually was at Downers Grove High School. It's just northish. It's about 15 minutes away from North Central.
From campus.
Yeah. And I worked with Katie. She was the awesome mentor for me. I'm still friends with her today, and she's still a great mentor for me as well. And so we worked together, and I helped them with their high school football season. And then later on, I ended up going back for a couple of games just to volunteer and help out and say hi.
Dang. So you really build a good relationship with them then.
Yeah, they were awesome. And honestly, I highly recommend it if you can, just trying to build a good relationship and find that mentor that you get along with, because they were very helpful in guiding how I wanted to be an athletic trainer and showed me the different routes that I can take, that I can still be myself, but still do my job.
That's awesome. That is true. Thank you for that advice. So what made you become an athletic trainer?
Oh gosh.
I know this is such a hard question, but
yes.
I know.
My experience is definitely not the normal one, I would say. So in high school, I actually ended up having a not good athletic trainer. We're not going to go too deep into it, but overall, the student body just was not appreciated and didn't listen to us about our injury concerns. And because of that, I ended up tearing my rotator cuffs in my shoulders, both of them. Because of that, a lot of PT ensued. And then because of PT and because of me being in the clinic, I realized that I wanted to do something along that route, but I didn't want to be stuck in a clinic. And so my physical therapist actually told me about athletic training. And I heard that, and then I associated it immediately with my high school one. And they said, actually, I think you should give it a chance. And so that's how I ended up doing it, a little bit in spite of the athletic trainer that I had, because I wanted to show them up and say, I'm better than you.
I'm better than you. That's awesome.
But also because what happened to me, I didn't want to happen to anybody else. And so now I'm working with a population that I can help prevent and actually listen to their concerns and needs.
That's awesome. It's a really cool experience, because when I think back, I'm like, why did I want to become an athletic trainer? My high school AT was really good, and he's the reason why I did it. And it's cool that it was like the opposite for you. But it's also a great mentality that you were like, you know what? I want to show that no other athlete should go through this. So
exactly.
That is really cool.
Because the pain and time and money that I went through, my dad went through trying to help me get through physical therapy. It was difficult for a while, but it was because of my physical therapist that they really listened to me and listened to what I was talking about, what I wanted to do with my future. And they recommended it to me, and they were the ones that were like, hey, you should give this a chance despite your bad experience, because maybe you could make a difference for somebody else. And that really stuck with me.
That is very true.
Yeah.
Okay. And then for have you had any experiences with working with other athletic trainers?
Yeah. So a majority of the athletic trainers I work with today are actually all athletic trainers at other deaf schools. So a really cool thing with my program, with my school that I work with, every season, the fall, winter, and spring, we travel up to 2 times. So this year alone, I have been to Texas, California, Ohio, Tennessee, Alabama, and Maryland. Oh, and DC.
That is awesome.
Yeah, so that was like last year and this year of where I've been so far. I've gotten to travel all over the country.
That is
It's
awesome.
amazing. And so I've gotten to meet a lot of other
Mm-hmm.
athletic trainers. So there's a little group of us, and it's me, the Maryland athletic trainer, Joe, the Florida athletic trainer, Josh, and then Texas athletic trainer, Brittany. And Brittany is actually the only one of us who is deaf, along with her students as well. So that's
Mm-hmm.
super cool too. So me, Joe, and Josh, though, we're all hearing, and we have
Mm-hmm.
learned sign language over the past few years. Joe is about 30 years my senior. He has been working with the deaf community for an extremely long time. He was actually an athletic trainer at Gallaudet University,
Mm-hmm.
which is one of the deaf universities in the States that is actually located in Washington, D.C.
Mm-hmm.
They are very cool. Their campus
That
is
is
super,
awesome.
super cool.
Really.
And so that campus is an
Mm-hmm.
amazing campus. And Joe, he worked there for about 20 years and then decided to be the athletic trainer for Maryland School for the Deaf, which is about hour 15 north of where Gallaudet is.
Mm-hmm. That is so awesome.
Yeah.
All these traveling, that's such a cool experience.
Yeah. It's pretty awesome. I never thought that I would have gotten to do any of this.
Yeah. So going off of that, then how did this opportunity come to you?
It, like you said, it literally kind of came to me. I didn't apply for it. I didn't know it was even an option. So I graduated and I went back to work as a medical assistant at Invista Optical, which is an eye doctor's office.
Mm-hmm.
In my time working as a medical assistant, I was also studying for the BOC because I was going to take it that summer. I didn't feel comfortable taking the BOC too early because I still had a lot on my plate as a student athlete. I had to work to be able to pay tuition and still finishing up my classes. So I didn't want to put too much on my plate and risk failing, and I didn't want to put myself under too much stress. So I postponed my BOC. And in doing so, it actually worked out phenomenally because I was able to take the time that I needed and wanted to be able to study and do everything that I needed to do to prepare myself for the BOC. So that was very, very good, valuable time. And then as I was working at Invista, a hiring manager reached out to me and she saw my degree, what it was in, and I told her, on our first conversation, it was just a phone conversation, I said, I am going to be taking the BOC. She said, okay, no worries. And so we finished up our conversation. I didn't think too much of it at the time, actually. And so she followed up a couple of weeks later, actually. I had taken my BOC by then, and I was just waiting on the results. And she said, well, you have gotten an in-person interview. I said, I didn't know that this was even still an option. She said, actually, the person that was going to be ended up not being a good fit. So they wanted to go back to the drawing board, and she recommended me per our conversation on the phone.
Oh, that's awesome.
Yeah. So then I went in for an in-person interview. It ended up going amazingly. The first thing they said to me is, I love your car. So
that's awesome.
Yeah, so it's funny. I got an orange Subaru Crosstrek right before I literally picked it up the week before I went in for this interview because my previous car sounded like it was going to explode. So I got that because that was what I wanted. It was perfect. And so I get there and like, I love your car. I love your car. I'm like, thank you. I love my car too.
You're like, I love it too.
Why do you love my car so much? And then we walk into the gym and everything is orange and black because our mascot is an Oriole.
Orange.
And it's orange and black. And so I was like, I understand why you love my car now. And so we then progressed with the interview. The interview was amazing. So I did have an interpreter for that, or else it really wouldn't have been possible.
Yeah.
And one of the first things they asked me, they said, "We know you don't have experience. Are you willing to learn?" I said, "Absolutely.
Yeah, absolutely.
Absolutely, I'm willing to learn because this is really, really cool." And so then they're like, "Okay, well, let's show you to your office." I said, don't you mean show me to the office? Because there has to be other candidates. They're like, no, we're going to show you to your office. This is yours if you want it. I'm like, sign me up. I'm ready.
That is so awesome.
Yeah, it was a crazy experience. Crazy experience.
Oh my God. What made you, were you able to ever ask them like why they chose you? Or like, why do you think you were a great fit for that position?
So I did ask, and they said it was because of how I conducted myself in the interview. It was because I didn't. So unfortunately, among hearing people, there is a very bad misconception that deaf equals stupid. I have seen it all too much from traveling with the kids, traveling with the deaf community, and having interactions that a lot of people have not very good outlooks, and they treat deaf people as if they're lesser than, even though they are not in any way. And I guess the other candidates had that sort of tone about them and were talking down and weren't putting them on an equal level. And so that was one of the reasons that set me apart and why they ended up giving me the job. So it was pretty cool.
That's awesome.
Not that it had to be like that, but also cool for me.
That is true. Congratulations with that, because that's such a cool experience as well.
Yeah, it is.
So jumping to like your previous history, you mentioned that you were you did not know any ASL, correct?
No, I didn't know ASL at all. I actually didn't even know the location of the deaf school, even though I had been by it, on it multiple times in my past from growing up here in Indiana.
Okay. Any other languages that you know of?
None.
No.
I am still learning ASL, but I am fluent enough now that I can get myself through all of my conversations in the day, and they are still teaching me stuff every day. So I learned a new one the other day of award. So you put your hands together like this and you push forward. That's award.
That's awesome.
That cool?
That is cool.
So that's award, and learning all of the new signs and what they teach me is amazing. The kids are great at teaching me because they want me to learn and they want me to be there and understand their conversations, and that's super cool.
Yeah. So how's your experience, like your overall experience with ASL, with like working with other peers who know it, and then working like you yourself, especially from the beginning? Like how did everything start or happen?
So it started on my first day. So once I found out that I passed the BOC, I immediately let them know, and they said, "Okay, when can you start?" I said, "I have to give my current employer 2 weeks notice." Fast forward the 2 weeks, and I start on my first day. The interpreter is there for 5 minutes to show me everything and show me my building, my office, where everything is at. And then they said, "Good luck." And that was it. I had no interpreter from that point forward. So I had to improvise.
Like from the first day or?
From the very first day.
Oh, wow.
Yeah. It was literally the definition of hit the ground running. I hit the ground running of I had zero experience with their language and culture. And then I had to figure out how to communicate. The biggest thing that benefited me in the beginning was a whiteboard and expo markers, dry erase markers. The good thing about ASL is that their written language is all in English. So we were able to write and communicate that way while I was getting my bearings and learning how to communicate with them. So for, I would say, the first year, really, I relied, or the first 6 months, definitely, I relied very heavily on the writing board and the dry erase markers, because that was the only way I could communicate, because I didn't even know the basics. I didn't know the alphabet or numbers, letters, any of that. I didn't know any of it. So the kids taught me everything I know. The kids, coaches, and administration, they have taught me everything I know. But
so you didn't take like an extra class or anything, like a course online? Oh,
no. So
that is awesome.
Yeah. So Oklahoma School for the Deaf, they actually offer a free online course. It's pretty cool. I actually have taken that one, but I didn't know about it at first. And so I took that, and they have ASL 1 and ASL 2, and it's for free, completely online, and you can do it and take the assessment and get a little certificate for it. It's a pretty awesome class, especially if you're somebody wanting to learn for fun or wanting to learn because you need to learn. And so I ended up taking that course, and for it being free, the quality was awesome. But no, so I didn't know or take any courses really other than that one. And so everything taught to me was from the kids, coaches, and administration, my colleagues. They all taught me everything.
That is awesome to have like a staff who's like helping you out and weren't just like, okay, it was kind of like a throw in the bus, and when they're like, okay, you kind of figure it out, but at the same time they still came in there and still helped you learn.
Yeah, absolutely. And the biggest thing that helped me too was learning how to finger spell. So being able to finger spell things, if I didn't know a word for something. So like, I'll give a little example. This, Gatorade. The sign for Gatorade is this. And you put your index finger out, your thumb up, and then you shake. You shake your wrist. That's Gatorade, because it looks like a, but I didn't know that. So I spelled out Gatorade. And they're like, oh, no, it's this. It's this. I'm like, oh, okay, awesome. So they literally showed me that after I finger spelled the word. And then they're like, oh, no, you can do this, and that will make your life a lot easier. I'm like, awesome. And so that's a lot of how I've learned, is that I'll finger spell a word, and then they'll teach me what that sign is for that word.
That's awesome. Do you think that made it so much easier, like when it came to like learning it right at that moment? Or
Absolutely.
do you, yeah?
Absolutely. So in high school, I had to try to learn Spanish, and also in college, I had to try to learn Spanish. And the conventional way of learning in a classroom like that was extremely difficult for me. And I will not lie, I did not do very good. I got myself through with a passing grade, but that is all I did. I didn't retain any of the information. It was extremely difficult for me learning that way. That's why athletic training was so awesome for me, because it was all hands-on. And in this way, ASL, American Sign Language, it's very hands-on. Hands-on, because you're literally speaking with your hands. And so when they taught me the signs, when they teach me signs even today, that helps me remember so much, because then I repeat that physical action and that movement, and that helps me remember and make those connections.
That's awesome.
Yeah.
Okay, so well, I was gonna connect it with you too. In high school, I took German. I speak Spanish. I'm fluent in Spanish, but I took German because I was like, I want to learn a different language. That was such a hard course to take. I think I agree with you that like I'm very like hands-on. Like I'm gonna show you how you're gonna do it, and this is how a little like puzzle thing. And I think like language is just so big, and how and like especially with ASL, like I think it's like the movement of your arms also reflects like in your brain. You're like, okay, this is how the word works and stuff. So that's really cool.
Yeah. And so another one, so me saying yes, you make your hand in a fist and then you shake up and down, and that's
Mhm.
literally yes.
Yes.
Um, I mean, it's simple stuff, but when you're putting it in action and making those physical actions for it, it helps tremendously in learning the
Mhm.
language. And so being able to learn it in the moment and then repeat it later on, it's awesome.
Yeah, that's really cool.
Yeah.
Okay, so now we're gonna shift a little bit to some articles I was able to read.
Yeah.
And I just want to think like make like some to see what are your perspectives on this and like what is your experience when it came to this. So there's an article called American Sign Language Interpreters Perceptions of Barriers to Communications in Deaf and Hard Hearing. So this article did mention that communication barriers between healthcare providers and patients who are deaf and hard hearing is less than ideal. So what are your thoughts on that? Like what is your experiences that you have with other healthcare professionals trying to talk to your kids?
Yeah, so that is extremely true. That statement is a resounding truth of the culture of the deaf community. And something that goes along with that is the patience you have to have with the deaf community to learn and gain their trust. You have to gain and earn their trust. It
Mm-hmm.
is not going to be given to you.
Mm-hmm.
It's taken me really until the beginning of this year to have the trust of my athletes. It helps that I can actually communicate with them now,
Mm-hmm.
but a big issue that I have learned that the deaf face is that they will be trying to explain something to a hearing doctor or somebody who is hearing. And again, what I said earlier of hearing people sometimes think of them as lesser than, of like deaf equals stupid.
Mm-hmm.
Not the case at all. But instead of taking the time to actually work with the patients and work with the deaf community, sometimes it gets a little dicey. And hearing people don't wish to utilize that time correctly.
Mm-hmm.
And they don't earn the trust of their patients. It's taken me about 3 years, give or take, to earn my patients' trust, to earn my kids' trust, even the coaches too, for them to come to me with concerns about an athlete saying, "Hey, have you seen this person? We haven't seen them lately and we're just concerned."
Mm-hmm.
And having the nurses at the school reach out to me and have their trust saying, "Hey, we know that they're an athlete. We saw them in the health center today.
Mm-hmm.
Maybe just check in on them before practice." And so having that communication is
Mm-hmm.
huge. But I had to be very patient. My
Mm-hmm.
patience was tested constantly because the deaf community, with the communication barrier, they are a very independent population. They will come in, help themselves to whatever they want, and leave without asking, looking at you, nothing. If you don't make yourself known, you don't exist.
Mm-hmm.
It's quite literal. Um, so, especially in that first year, I had kids coming in constantly, which I didn't mind. I loved seeing them, but because I couldn't communicate, they just helped themselves to whatever they wanted.
Mm-hmm.
And so I had to I had to delicately try to morph that into, hey, when they come in, can I have something? And the biggest thing are like a band-aid. Can I
Mm-hmm.
come in and have a band-aid? Can I have a band-aid? Absolutely you can, because then
Mm-hmm.
that opens up that communication with me, and I can grab that for them and they will know that I understand them and I'm
Mm-hmm.
willing to help them and make that action, make the effort,
Mm-hmm.
really. Yeah.
That's awesome. Yeah, honestly, like I never had that perspective of like it's not just the language is coming in, but also like them being so independent and like it can be little things as them coming in be like, "Oh, can I use this?" or something instead of just coming in and grabbing it. Like I mean, in the ATR room like right now, there's kids who just come in, grab their stuff, work on it and then just leave. And like
Mhm.
now like building that small connection, because then they start saying, oh, hey, how are you? Or hey,
Yep.
I did this in class or something. And then that's how you slowly start building that relationship, which is really cool.
Yeah. And so having to learn how to build that relationship and really work with them and work for them. I mean, I'm there for them, and I had to gain their trust. And now that I have, my daily life with them is amazing. I mean,
Yeah,
they come in, we're having full-blown conversations. The kids aren't afraid to ask me for things, and that's all I could ask for.
that's really cool. So for the second article, we have under the American with Disabilities Act, healthcare facilities are legally required to provide ASL medical interpreters. However, in a survey of physicians, respondents indicated that only 22% actually used ASL interpreters. Did you ever have an experience of going to the ER or any physician's office with your patient and actually have an ASL interpreter, or were you assigned that role when you got there?
Yeah, so I actually have an experience that happened just this past fall with football. I had to take one of my kids to the emergency room. He ended up getting a laceration on his scalp and ended up needing to get staples. Um, the emergency room that I took him to, they did have an interpreter on site. It was through a digital communication service, but that interpreter did not do a good job, and I ended up taking over for them. And part of that issue, so you know how with athletic training, I don't know if you've talked about yet, of athletic trainers face some issues with the licensing of others sometimes, where you have somebody who comes onto a field and says, I'm an athletic trainer, but they're actually not an athletic trainer. Interpreters in the deaf community face this issue a lot as well, where people who say, I know I can sign, I know how to sign, and they actually don't, and they are actually making it a lot worse for the community. Their official certification is called the RID-NIC, the RID-NIK. It's the Registry Interpreters for the Deaf. It's their national certification. It's the National Interpreter Certification. That is what any good interpreter will have. If they are an interpreter, they will have that certification. Companies need to know about that, because if they have a deaf employee or they have deaf patients, anybody who needs to use ASL, they need to make sure that they have somebody on site, whether it be through the medical world or through meetings, just any basic communication. They have to have a registered interpreter, a certified interpreter, and that is their actual certification, what it's called. It's the RID-NIC. And so when I took my patient to the hospital, when I took him to the hospital, they did not. That interpreter was, it's actually infuriating to even talk about it sometimes, because they were making my kid so confused. He had no idea what they were talking about. And because the thing too, with the deaf community, it's a very visual community. If you are talking with somebody, so say I'm talking to you, but you're deaf. So I'm talking, but I need to use an interpreter. Well, the interpreter would either be in front of you directly or off to the side a little bit, and you would be looking at them so they can sign and you can see what they are saying. Well, another issue is that when you bring in an interpreter who's on a tablet, if that lighting on the tablet, the brightness isn't up or anything, they can't see. And so if they can't see what they're saying, they're going to have no idea what that person who's talking to them is saying. What I ended up doing, I told the doctor, I said, look, I understand you have this, but you need to not use it, because one, this person is not signing correctly. If they were, then my kid would have zero issue communicating with you right now, but they are not. So I ask that you take this away and I will start interpreting and I will be that medium. They said, okay. That also helped too, because that kid trusts me. I'm a medical provider for him. And so he was able to communicate what he needed to through me. And I was able to tell the doctors. And so that was one of the things that was just one of the experiences and that's why it's so important for interpreters to have that certification, because then they will literally have the right way to sign. And it allows for clear, effective communication.
Yeah, that's very true.
Yeah, because a lot of times I end up, if we don't have an interpreter on site, a lot of times I end up being the interpreter for various situations.
Yeah. Yeah, I actually had an experience like that going to the hospital with my grandparents and my parents, because they're Spanish speakers. So when we go to the hospital, they do require an interpreter there for them, even if we're there and we can interpret it, just because they have that certification that you're mentioning for Spanish speaking. And my grandma had passed away, so the doctor was explaining exactly of everything that had happened during the procedure, and everything she had said was completely different than what she was supposed to be saying. Like, the doctor would give this long explanation, she would interpret it in like 3 words. And like, I remember my mom looking at me like the doctor just kept talking and she just said something in 3 words. And like, it's kind of like irritating, and like, it's like anxious too, because you're there and you're like, that's not what that means. And like, that's not what they're saying. Like, they're communicating things that are wrong and like making it even worse. And like, I remember getting to that point, she was explaining everything, and like towards the end, like, she was like, doctor, the patient is deceased, correct? Like, at the end. And that's where everyone was like, wait, so like, you didn't even know that like, it was such a big deal, where we're like, she's not interpreting anything correctly. It was frustrating. Like, families are going through something and then having to think even more of like what they're actually saying. Like that's why I feel like this topic is so huge, because it's just language barriers and communication with barriers is such a big part of like the healthcare profession, because we're such a diverse country. And so that's why I was like, we need to get to this. We need to have this conversation a little.
I love this topic, especially now that I have experience with it. Oh, I can go all day.
I know that is so true. So yeah, this article is the overall theme of like the communications, and like the ASL interpreters were not doing things correctly, or like they didn't feel comfortable, like the patients didn't feel comfortable. So yeah.
And so when I ended up taking over, the communication went off without a hitch. We were able to talk. My kid was able to tell the doctor everything that he felt was going on, because he ended up getting a concussion as well because of the head laceration. Which before he was trying to tell the interpreter that, but the interpreter was not saying that. And that was when I stopped the interpreter and I had them take them away, because he was explaining signs and symptoms of a concussion, but the interpreter was not telling the doctor about that. And so if I wasn't there and if I wasn't able to understand him, they would have missed that concussion potentially, and who knows where we would have been. Because it was a severe head laceration, and they ended up sending him for a CT once I got him talking with me, because I told them, I said, look, the interpreter didn't tell you all of this. They said, really? I said, yes. They said, okay, well, let's go back in. Can you interpret for us? I said, absolutely. So we went back in, and then he was telling them about his concussion symptoms, and they said, well, we need to order a CT. The CT came back clear, but if they didn't do that CT, that head laceration could have also been an internal brain injury, and it could have been a traumatic brain injury. And so it goes without saying of how important it is of having proper communication.
That is very true. Like, imagine if you weren't there, like that would have completely gone differently.
It would have. And it would have also been extremely upsetting because say he got a severe concussion along with the laceration and he got cleared to return. Well, if he got cleared to return, but he was still having concussion symptoms, that raises a lot of red
Mhm.
flags for me as an athletic trainer because I'm not going to let him return if he has a concussion.
Yeah.
Those are too serious of injuries to allow to just return like it's nothing.
Mm-hmm. No, that totally makes sense.
Yeah.
So for the next one, so this article is talking about like willingness to communicate for a second language. So researchers have shown that personality trait factors can affect language learning success. So they use 3 different ones, extroversion, agreeableness, and consciousness. What are your thoughts on these traits?
It's funny, I actually had to look up what extroversion meant. And it turns out it means measure of how energetic, sociable, and friendly a person is. Um, Outwards, I I think honestly that all 3 of these traits, the extroversion trait, agreeableness, and conscientiousness, I think those are all very important because if you are able to find that good middle road
Mm-hmm.
with being able to learn that language, but also keep your boundaries without getting too close,
Mm-hmm.
it is huge. Being able
Mm-hmm.
to say yes to a lot of things, but also knowing when to say no,
Mm-hmm.
because that's something I've had to learn too, is that I will not always be able to say yes to the kids wanting things or to the coaches wanting
Mm-hmm.
things. And being agreeable to what I can do and then being conscientious of I know I said no to this, but here's what I can do
Mm-hmm.
to try to mitigate this.
Yeah.
And the extroversion, I mean, being able to be sociable and
Mm-hmm.
friendly and put on a good face because again, with sign language, the meaning of a word, the meaning of a sign sometimes depends on your facial expressions.
Mm-hmm.
You can say one thing but mean a completely different thing if your facial expression is wrong.
Mm-hmm.
And I've had that issue before in the past where sometimes I will have the wrong facial expression, but I signed something different.
Different. Mm-hmm.
But because of my facial expression, that meaning of that sign changed drastically.
Mm-hmm.
And so it's something that is important to know is that you have to have the ability to control your emotions and know that you have to communicate things multiple times over.
Mm-hmm.
And that's okay.
Mm-hmm.
Being able to be patient. Another trait that I think is important here is having patience.
Having patience.
If you don't have the patience, 1, learn it, or 2, move on. Because if you don't learn to have the patience, they're not going to have the patience
Mm-hmm.
for you. And then you're going to completely break that relationship and burn that bridge before
Mm-hmm.
you're even able to get started.
That's true.
Yeah.
That is true. So going back to that then, what do you think is the hardest part of your job? Right at the so at the beginning of it and at the end. Well, not at
So
the end, but currently.
yeah, so at the beginning of my job, earning the trust of my patients, the parents, the coaches, all of them, earning the trust of the deaf community.
Mm-hmm.
Communication wasn't as big of a deal because they were willing to work with me and I was willing to learn.
Mm-hmm.
And being able to have that on both sides is huge. If you don't have somebody willing to learn and you don't have people willing to teach, then that communication is already kind of gone. But because of them being able to be willing to teach and me willing to learn, the biggest issue was earning their trust.
Mm-hmm.
When they came to me, because especially in the first year, they thought whenever they came to me, I was going to sit them immediately.
Mm-hmm.
And so they never wanted to tell me about what was wrong. And so, and I still say this a lot today to all of my kids, my job is not to sit you. My job is to ensure your health and safety.
Mm-hmm.
That's all I care about. If that means I need to sit you for 1 or 2 days or however long it may take, then we will have that discussion when it comes. But I'm not going to sit you. That's not my job.
Mm-hmm.
That goes, and specifically with my kids, their previous athletic trainer, that's all they did.
Mm-hmm.
They had a previous athletic trainer years before COVID, and all they did was when a kid went to them, that athletic trainer didn't do anything, didn't have a conversation, didn't do an evaluation. They sat them immediately. And so there was a big issue with that when I started, of the kids didn't want to come to me because they were scared I was just going to sit them.
Mm-hmm.
And so I've had to earn their trust and figure out how to get them to understand that I will only sit you if I need to.
Yeah.
And really, for the hardest part of my job right now is just maintaining open lines of communication with coaches.
Mm-hmm.
The deaf community sucks at communication in general. Practice changes, they will not tell you about it if they don't think you're important. So if there are any changes in the schedule or anything, they will not say jack unless you reach out to them. And so I am constantly reaching out, making group chats, texting, because another thing too is that you can't call because they won't answer the phone. So you have to text. True. And if they don't feel the vibration or anything, because they can't hear the notifications, you're waiting sometimes hours for communication back. So the biggest thing is just maintaining open lines of communication right now. But that is getting better as well. It's getting better as I have gotten used to the community and how they can, because when I go onto the deaf campus, and I never thought I would ever have to say this, but I'm a minority on their campus. Being a hearing person, hearing people are the minority, and you have, as a hearing person, you have to conform to their community. They will not change for you. And that's a big thing too, of why I think previous athletic trainers didn't do well in the past, was that they had a difficult time changing their ways to be there for that community. So yeah,
makes sense.
Yeah. And so working with the middle school, high school population, it's I have to conform for them. They will not change for me, and they shouldn't have to.
Yeah.
I want to say that, like, they should not have to change, because the deaf community, that deaf campus, that's their safe space. That's where they can be deaf and not have to worry about anything else. That's their safe space, and that's what it needs to be, because that's the whole point of having that campus, is having the kids be able to know I can sign, and I'm not going to have somebody look sideways at me and think I am a crazy person.
That is true.
Yeah.
That is true. So then overall, how's your experience with working with such a broad population? Because you do have, is it from pre-K to high school, or?
So yeah, the entire campus is pre-K to high school, but I only work with middle school, high school, because that's where our athletic population is.
Okay.
Sometimes I help, sometimes I help out in the health center if they get a kid in and they're not sure what's going on, which I don't mind at all. It, again, helping with the communication and having those pathways open and maintaining good relationships. And so sometimes I help out if they need me or ask me to, but other than that, I really only work with middle school, high school, predominantly high school, because that's where we are traveling a lot and doing a lot. I love it. I would not ask for I wouldn't ask for it to be any other way. I mean, I never, ever thought that this was an option. So, and Kendall and Taylor, they'll tell you, when I started with the athletic training program, I didn't want to be in high school. I didn't want anything to do with it. I was really looking at potentially college, law enforcement, military. Those were the settings that I was looking at. But then this opportunity arose, and it's because of how drastically different it is that I think it made me a lot more open to the idea of the secondary school setting. And also, it's because of once you earn the trust of this population, they appreciate you to the ends of the earth. I mean, the amount of love and appreciation that I get from the kids and my colleagues on a daily basis, the coaches saying, we love you, we appreciate you. It's incredible.
That's awesome.
You hear a lot of horror stories of athletic trainers not feeling that appreciation, feeling like they are not doing their jobs, things like that, because they are trying their best, but just they don't feel that love. They don't feel that community. And I, surprisingly, once I've earned myself into that community, I mean, I'm kind of like one of them. I'm not one of them, but in a way I kind of am, because they want to include me on things. You know, the coaches and the kids are constantly asking, hey, are you going with us on this trip?
Yeah.
Are you
That's
coming?
awesome.
Because if you are, like, we're good. We're ready. I'm like, yes, I'm coming. And it's incredible because my basketball girls, they're my babies. I love them. They're definitely probably one of my, if I had to choose a favorite, my favorite.
You'd like it to be them.
We all have our favorites. It's fine. They won for the 3rd year in a row the National Deaf Basketball Tournament.
That's awesome.
So we went to Maryland for the National Deaf Basketball Tournament. It was incredible. They played phenomenally, and they won, and they were so amazing. And when we won, the biggest hugs. They gave me the biggest hugs. The girls and the coaches, all of us just like losing our minds on the court after the time expired and we officially won the championship game. And it was amazing to be able to have that. It was so cool. And them all coming up to me after the game saying, thank you so much. We love you. We're so happy that you're here with us.
That's awesome.
Yeah. And so, I mean, I'm so happy I've stuck it out with them because I wouldn't have it any other way. Having this job, it's incredible. It's truly incredible. And the deaf community is a gift. I love it. And if somebody is willing to learn ASL and be a part of that community, I will 100% support them.
That is literally awesome. I feel like that's a life goal that you're like, I want my athletes to be happy I'm here. Being able to trust them and be able to communicate effectively with them is such a huge part about athletic training.
Yeah. And, you know, so, and the thing too is that, like, going back to the beginning of my job, I had a kid who, it was within the first 2 weeks I was hired. And remember, I was only communicating with a whiteboard. I only had a whiteboard and dry erase markers. I had a kid who was suicidal. It was not, so unfortunately in the deaf community, mental health is a big issue. They, again, because medical professionals sometimes don't take the time, or or interpreters, that communication isn't there, a lot of things can be overlooked. And so I had a kid who, he was experiencing some pretty severe bullying from some other kids, and he was suicidal. He's transgender. So before he was a girl, but he transitioned to being a boy. And the other boys weren't appreciative of it. And they were treating him pretty horribly. When we found out, when the adults, all of us found out, we immediately put the kibosh on it. We said, you do not discriminate or treat anybody like this, no matter who they are, no matter what they choose to be. It doesn't matter whether they choose to be transgender. It doesn't matter whether they choose to be gay or straight. They can choose. That is their choice. And so the bullying got so severe, though, that he said he was suicidal. He said he wanted to hurt himself. And so immediately we sat down, and even though the conversation we had was all on a whiteboard, which it's pretty difficult because talking like this is so much easier instead of having to write everything out and put that into a written explanation, basically. But we were able to sit down and we talked, because once I found him, because we were running all over campus trying to find him because we couldn't find him for a second. We found him, and I brought him to my office and I said, look, I'm going to have you sit here and we're just going to talk. I don't care what it's about. I don't care if it's about, it can be about anything you want. We can just talk. And me taking that time, plus, once his father came and picked him up, they went, and him and his dad he came to me the next day and he said, look, thank you so much. I appreciate what you did. And he wrote it all out. And he said, we went to the gym later and then we got ice cream. And I'm like, oh my God, that's so sweet.
That's so sweet.
And he said, I wouldn't have done that, though, if you hadn't taken the time to talk to me. And so even though I couldn't communicate, you still
found a way.
Yes, found a way. And that's what matters. And I think if there's like any point that I could drive home, just make the effort, because that will open so many doors.
That is very true.
Yeah. And, I could just keep talking for hours.
Right.
Because, it's just like, there's so many things that I've had, especially like when I went back to that emergency room. But then, there was another thing that when last year we were in California, and one of my kids, he ended up completely rupturing his LCL in a football game. We are from Indiana, so we are literally across the country.
Yes.
Luckily, his parents were there, though. So his parents came and they said, what can we do? Do we need to take him to the ER? I said, no, you don't. He has his vascularity is fine. I don't know if I said that right, but whatever. His vasculature is fine. His nerves are fine. He feels everything. He has blood flow. He is able to bear weight on it, despite it hurting a lot.
Yeah.
If you want to wait to get him home, you can, because the first thing they said to me, and I was able to sign by now, they said, we don't feel comfortable taking him to an unknown doctor, an unknown ER. Yeah. We don't feel comfortable because we're not sure if he'll get the standard of care that he needs. I said, I agree. So here's what we can do. We will borrow crutches from this school. Once we get the crutches, I will put him in a wrap and he will be stabilized basically until we leave. They said, okay, that's awesome. How are we going to do that? I said, all you have to do is, luckily they were also on the same flight, which was huge. I said, all you have to do is let me know when you guys get to the airport, and we will hopefully be there by the same time. Then we got him in a wheelchair, so we wheeled him through the airport. And then the biggest issue was the flight attendants. Woo! There was a flight attendant on that flight, and I was not a fan of her.
Oh my God.
So like I said before, of people saying deaf equals stupid. Yeah, she was one of those people. And just being downright mean to the kids for no reason. I mean, just like snapping at them and like putting her hands in their faces, trying to get their attention. Like, that is not the way to do that. That is an invasion of personal privacy, personal space, all of it. She was just not having it. I mean, she was, and part of it, when we got him onto the plane, I said, hey, we're about to land. Can he get off first? He's on crutches. He can't walk.
Which makes sense.
Yeah. She said, no, he can't get off first. I'm like, why not? He can't walk. His knee is swollen to the size of a softball. It looks like a freaking cantaloupe compared to his other knee. Like, can he please get off first? And she said no. Unfortunately, our policy is everybody has to get off when we allow them to. We can't make any changes or, you know, any exceptions to those rules. And I said, okay. And I got snappy. I said, okay, you can leave now. Like, I dismissed her. Like, I'm her boss.
Right.
I was pretty upset because he was in a lot of pain, and his bruising and swelling was pretty extreme. And we knew the risks of flying home, but we needed to get him home because we couldn't trust the caretakers in California, unfortunately.
Yeah.
And so what I did was then I went up to a different flight attendant and I said, hey, is this possible? She said, absolutely. There's no issue at all. Yeah, I know. And one of the people sitting in the front rows overheard our conversation. They said, hey, if this helps, I'm more than willing to like switch seats with him. And he can come sit up here in the front row so it's easier for him to get off. And I was like, oh my gosh, thank you so much. That is very kind of you. Yeah, absolutely. Because there was an open seat behind them. They said, oh, there's the open seat right behind me. There's no issue. And the flight attendant was like, yeah, absolutely. If you want to do that, there's no issue. And I'll make sure that I get his wheelchair and we can get him off immediately. And he can be the first one off. And literally in my mind, I'm like, so how hard was that?
You're like, I went through all this stress.
Yes. And the other flight attendant made such a big deal about it. And I'm like, he can't walk. We're not asking this just because we can.
We can, yeah.
Like, he can't walk. And it obviously wasn't that hard because the other one said yes immediately, like it wasn't that big of a deal. And the looks I got from that old lady flight attendant getting off that plane. I was, my intrusive thoughts won, and I was very proud of myself for doing it.
I would have been like, haha.
Oh, absolutely. And so it just, overall, though, even with those bad experiences, I was able to be there for my kids and be there for their parents. Yeah. Because again, parents are deaf too. Everybody is deaf. I am one of a handful of people on our campus that speaks. It's me, some of the health center nurses, the interpreters, and our campus police. That is about maybe 10 people altogether that are hearing and speaking. So when we come across issues like that, I get very heated sometimes about people get like that. Yeah. Like, I don't understand why you're treating them so differently when there's nothing different about them other than they can't hear you. And like, there's nothing different about them. They even say it all the time. We don't want to be treated like we have a disability because we really don't. I mean, they play in the IHSAA tournaments. They play in all of the normal, quote unquote, normal tournaments with other hearing schools, and there's zero issue. So I find it sometimes very infuriating with how other people treat them just because of their supposed, quote unquote, and disability. Yes, it's a disability by our standards, but for them, it's normal. It's their way of life. They have no issue with it, and they're actually proud of it. Yeah. It's a community. There's camaraderie there. And so I find it very interesting, and I find it very honestly empowering to see how they come together as a community and they don't allow their differences to make them different.
Yeah.
Because I have I have a couple of kids who they play in normal club sports. They play in the
Mhm.
hearing leagues. And so I think it's important that people understand that they are not different.
Mhm.
They are normal. They are just like us, and there's
Yep.
nothing different about them. Yes, they can't speak, but who cares?
Right.
They
Who
can
cares?
do everything else. Yeah.
Right.
So, yeah.
And there's still
Sorry.
so many other ways we can communicate that,
Oh, yeah.
yeah, it's
There's so many ways, and like I said, I could go all day droning about just keep going on and on about all of this. But
right.
I know you also have things you places you
No,
need to be. So
you're good. Is there any like overall advice that you give me right now that I'm in my MAT program?
um keep trudging through. It's going to be difficult and you are going to get burnt out. You're going
Mhm.
to feel tired. You're going to feel over it sometimes, but keep trudging through because I'm so happy I did. There were a couple of times that I felt, well, more than a couple of times that I had struggles during my 4 years, but my friends got me through it, and so did my family because I was able to talk with them about it. And I said, "This is what I'm dealing with." They said, "Okay, keep going,
Mhm.
don't stop." So keep going.
Mhm.
Don't. If this is what you truly want,
Mhm.
it does pay off
Mhm.
because, um, like I said, I never thought I would be in the position that I'm at as a head athletic trainer with
Mhm.
literally only 3 years of experience. I'm on my third year.
That's true.
Like head athletic trainer, working with the deaf community. All of these, even like the setting of the deaf community, I never even thought was an option. I didn't even know existed.
And you traveling so much with them too, that's awesome.
Exactly. Yeah. I mean, them wanting me to go is
Mhm.
incredible. And so just keep going.
Mhm.
Don't let yourself stop because if you let yourself stop, you don't know what you're going to miss out on.
Mhm. That's very true. Very,
Yeah.
very true.
So if I have any 2 cents, there it is.
Well, thank you so much for joining me today.
Yeah,
We can always go back and watch this podcast. I would try. I'm gonna see if I can download it and then submit it by tomorrow. Latest tomorrow, probably. I have all day, so I'm pretty sure that by tomorrow I would have this set. I will send you where we can watch it. But thank you once again for taking your time and doing this.
yeah.
I know there's a lot of experiences and yeah, a lot of experiences and challenges that you have faced, but I have learned a lot from them. And hopefully, like if you have any other questions or if I have any other questions, if you're open to me communicating with
Please,
you.
please reach out. If you have any questions or just want to chat, please reach out because it would be amazing to be able to talk about this. I mean, I think
Mm-hmm.
it's a really awesome population. And so
It
if
is.
anybody in your classes want to reach out, anybody, I don't care. I will talk to the ends of the earth.
Right. Well, I really appreciate your time for doing this. I do.
Yeah, anytime.
Well, have a great one, and then I'll send you this whenever we can.
Okay, that sounds good. Thanks.
Thank you.